Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of urothelial carcinoma. So, how do you diagnose the urothelial carcinoma? This urothelial carcinoma can be diagnosed by first, you can do a ureteroscopic brush cytology. That is, you will introduce some type of instrument into the ureteroscope and you will get the malignant cells and you will get the cells, you will obtain the cells, and when you look under the microscope, if you find that there are malignant cells, then you can diagnose it with that. Or intravenous pyelogram may show radiolucent transilluminant filling defects. Why? Because it's quite simple. There is a tumor in the ureters. Okay, the tumor is present in the ureters. That is, this is the tumor. Just think that, and you have done an intravenous pyelography. If you have done an intravenous pyelography, here the filling of the dye is normal, but once it comes to the tumor area, only in the here, like this, you will see the tumor filling. And once here, because the tumor cannot be seen, because we cannot see the tumor here, so obviously this is the part which is not, there is no tumor here. So if you just remove this part, see, you will see a filling defect is seen, right? So you will see radiolucent intraluminal filling defects will be seen in intravenous pyelography. Then you can do a CT urography. CT urography is actually the investigation of choice for evaluation of upper urinary tract. So with the help of CT urography, you can evaluate the upper urinary tract and you can see if there is any urothelial tumors. These urothelial tumors have mainly the ureteric dilatation is seen below the site of the lesion. Because there is ureteric dilatation is seen below the site of the lesion, this will actually appear as a goblet. So there is appearance of goblet is seen, and this appearance of goblet is actually seen in the retrograde retrograde pylography. So if you do a retrograde pylography, in the retrograde pylography you will see that there is appearance of goblet shaped is seen, because you will see that there is below the site of the lesion, if this is the lesion, below the site of the lesion dilatation is seen, and because of this dilatation, this gives an appearance of goblet shaped lesion. Then we have Bergman sign. Bergman sign is seen. In Bergman sign, if this is the ureter and if you try to pass a catheter through the ureter like this, the catheter will flow and it will pass till here. But wherever the obstruction or the tumor is present, if this is the tumor, okay, this is the tumor obstructing it. So distal to this tumor, it is very difficult for the catheter to pass, and as a result the passed catheter will coil off here instead of passing distally. So this coiling of the catheter, when a ureteral catheter is passed into the ureter, it is called as the Bergman's sign.
thank you and thank you for watching.